Over the past year, the Biden administration has been on an unrelenting crusade to get the COVID shot into the arms of every man, woman, and child in America, all the while completely downplaying, if not ignoring, natural immunity. And even when confronted about it directly, administration officials have shrugged it off. Here's what the president's chief medical advisor had to say when last September he was asked about whether those who had COVID and recovered should still get the shot, even when natural immunity may provide better protection than vaccines alone.
I think that is something that we need to sit down and discuss seriously, because you very appropriately pointed out it is an issue, and there could be an argument for saying what you said.
Well, it's been about 5 months since that interview, and I'm still waiting for Mr. Fauci to sit down. Well, fortunately, medical experts have not waited for Mr. Fauci and his funding to look at natural immunity. A new study was published last Thursday that looks at this important aspect of fighting the COVID virus. Joining me now to talk about what he and his team found in this new study is Dr. Marty Makary, professor at Johns Hopkins School of Medicine and School of Public Health. Dr. Makary, welcome back to Washington Watch.
Great to be with you again, Tony.
All right, let's get straight to it. Can you tell us about your study and what you and your team found?
Sure. Well, what we found is that if you had a positive COVID test in the past, then you had a 99.3% chance of having circulating antibodies against COVID. And those antibodies were present up to 20 months, nearly 2 years after the infection, because that's as long as the infection's been around. So what we found is that natural immunity is real. It was relatively stable over time, unlike vaccinated-generated antibodies. And we also found that you can operationalize this by simply giving credit to those who had a positive COVID test in the past. That's what Israel's doing. That's what European countries are doing. Any scientist who's honest, who has retained their objectivity, is now recognizing natural immunity as a powerful form of immunity. We don't want people to try to get the infection, but if you had it and recovered, that is solid protection. And that's why we recommend 0, 1, or maybe 2 vaccine doses in people with natural immunity, depending on their risk level. They simply need a booster.
All right, so several questions for you, Dr. Makary. First off, isn't that kind of normal? I mean, when we look at a virus like this, do we not factor in natural immunity as a part of our approach to kind of boxing in that virus?
Every virus is different, but with most viruses, the immune system works to prevent reinfection. And that's why the CDC's website says, don't get the chickenpox vaccine if you had chickenpox, because you've got natural immunity. The other 2 coronaviruses that caused serious illness in humans besides COVID were SARS and MERS. Both gave long-term natural immunity when they were studied.
So, I mean, I would think the default position would be, let's take a look at this and see if, in fact, it works. That way, we've got a limited amount of vaccines. And if we know that those who've had it are going to have a certain level of protection based upon what we've seen in the past, we can use that limited supply to get to people who really need it and are at a higher risk. Would that not be an appropriate approach?
Well, that's the exact approach we should have taken, and the approach many of us advocated for until we were blue in the face. I mean, I wrote almost 50 op-eds during this entire pandemic, and many of them, pleaded with public health officials to listen to other opinions. There was so much of a concentration of power. A small group of doctors in the government who were politically charged or appointed were making all the decisions, and they were like-minded, and they were not listening. That's the broader story. If they would have listened to us about natural immunity and started with the right starting hypothesis that it works instead of the skeptical hypothesis saying that it doesn't, then we could have saved tens of thousands of more lives by allocating the scarce vaccine supply more rationally back when we had a very scarce supply. And we wouldn't have ruined all these lives. These nurses who've been fired with natural immunity for not being vaccinated, soldiers dishonorably discharged. We have ruined so many lives for no good scientific reason. And we're still seeing the dismissal of natural immunity, pushing boosters in young people and other policies that are scientifically irrational, but people hold on to them because this is now a political bandwagon that public health officials got started.
You mentioned you've written a number of op-eds. I'm just reading one that came out last week where you wrote that the National Institutes of Health repeatedly has dismissed natural immunity by arguing that its duration is unknown, but then failing to conduct studies to answer that question. So they said, well, we don't know, so we can't really say if natural immunity works, but they never studied it. Why? Given the fact that that's been a factor in the past, why didn't they study it?
Well, I would suggest that they don't want to know the results because, look, the study that I did out of Johns Hopkins with my research team that was published last week in our number one medical journal, the Journal of the American Medical Association, or JAMA, gave the results that many of us have been postulating the whole time. And all this research that's been done between the early days of the pandemic when they tried to challenge rhesus monkeys with the virus after infection and found they did not get reinfected, to the bedside observation that people who are healthy and get reinfected don't get severely ill. They're not on ventilators, with ultra rare exceptions. And all of the data that has come in, the Cleveland Clinic, Washington University, over 140 studies documented by the Brownstone Institute. Why am I doing this study when the NIH has $42 billion and could have done this study instantly? And I think what you have is a loss of scientific objectivity. The science is now heavily curated, and even the CDC's own study on natural immunity, which came out 2 weeks ago, showed natural immunity was 3 times more protective than vaccinated immunity in protecting against hospitalization. Yet the conclusion they wrote fit their predetermined narrative, and it's read that vaccination is still the safest strategy. That's not what the data shows. That's what I recommend for people who haven't had the infection, but that's not what their data shows. They buried the lead of their own story, and it speaks to this agenda. We have the most political FDA and CDC in U.S. history.
Yeah, and so they have not changed their mandates and their approach to this. But I want to go, and I know you speak what the science says, and this is kind of a political question, so you may not want to address it, although I think you probably will. Is there a structural flaw in the fact that these policies that we've seen that have been put forth by the administration, recommended by NIH and NIAID, that they're the ones that are they're the chief advisors to the president, the administration, but they're also the ones providing grants and funding to many of the researchers and medical experts that might do research that would challenge their policies. Is there a structural flaw in what's happening in Washington?
Yes, and that is only people who are like-minded are invited to be a part of the discussion. And we, of course, now have from an email that came out from a FOIA request that an opposing view early on in the pandemic, which was the view of Jay Bhattacharya and other colleagues I know nationally who have been spot on, and they've been vindicated, that the NIH director called for a quote-unquote devastating takedown of their ideas. And instead, they just talk among themselves. I can tell you there have been private high-level meetings among public health officials in the last few weeks because they invite in some experts, and I'm friends with people nationwide in this area. And they have these discussions, and they're living in their own bubble. They're not even thinking about an exit of the pandemic. They're not thinking about exit criteria. They had a sort of small vote among some of their experts about whether or not they should recognize natural immunity. The vote was split, and they decided not to recognize it. This should not be an oligarchy. This should be an open scientific debate instead of discrediting those who give different opinions.
I mean, I thought it was all about following the science. And it now is made it's become very, very clear that as we have pursued policies related to COVID-19, it hasn't been the science. Now, I'm sure it factored in at some point, but it looks like it's more the politics than it is the science.
Well, this is why two of the most respected high-level FDA officials last year, including the head of the vaccine center at the FDA, quit in protest over political interference from the White House over vaccines, specifically boosters in young people. And they didn't keep their ideas a secret. They wrote a lot in the medical journals and even in the Washington Post about this sort of new world of making a decision and then trying to find science to fit it. You know, if you look at the data on boosters out of Israel, in older people, I should say, there was a reduction in hospitalization. And so for people who haven't had natural immunity, I recommend boosters in folks over 65. But Dr. Fauci immediately saw that data and said, this is dramatic data, wrote up a lot of policy, and then around the same time, the same Israeli population data came out on natural immunity, and he ignored it. Even though it showed natural immunity was 27 times more protective, didn't say a word. You cannot cherry pick the science, and that's unfortunately what we're seeing now with our government doctors. The good news is people see through it. They're listening to their local doctor, and they're not listening to the government doctors.
All right, Dr. Makary, I want to switch a little bit and focus on, all right, what do we do now that we know this? And I go back to your op-ed, your piece that you wrote last week, and you're calling on businesses and others to correct the actions that they took. You point actually to some companies like Starbucks and others that are calling back employees that they fired because they wouldn't get the vaccine. So you made reference to this earlier, a lot of good people, doctors, nurses, first responders, members of the military, you know, they're owed an apology, and we should bring them back.
That's right. It's time to bring back workers. It's time to get back to work. There's a small group of Americans, maybe 5 million, who are at risk of COVID. They haven't had natural immunity, and they haven't had vaccinated immunity. And I doubt they're going to get vaccinated now, although I'd encourage it for them. But we can't hold up the rest of society because of that small holdout. And those people are still at risk, and they still come to the hospital. But 95% of the country is either immune or low risk. And we've got to move on. People have lost the human connection. Communities, churches, workplaces, our doctors' conferences have not been meeting. We have not been talking about medical advances. We've got to get back to working, and that means hiring people back with an apology. The calculus is different. Population immunity is higher. And so we've got to get back to a normal existence. And that's what you're starting to see. People are pushing back against the politicians, different parts of the country, and they're saying, we need normalcy.
We do, Dr. Makary, because, you know, we've had 3 variants, and there's many other variants out there, but we've had 3 major in this country, and there's probably going to be another one. And so we just have to learn how to live with it and deal with it, just as we have the flu.
That's right. We've got to look, 10 to 20% of the U.S. population gets infected with a respiratory pathogen every year and has for centuries, okay? That doesn't mean we stop living. It doesn't mean we shut down schools and cover the faces of kids with cloth masks. It means we use common sense, which is basic hygiene. If you are sick, stay home, avoid others, and if you've been around someone who's vulnerable, be careful. So we've got to get back to some basic principles because we are going to have variants in the future, and we've got to learn to live with them. The good news is, statistically, they will be milder, and it's tough to outperform Omicron because it was so contagious.
Well, Dr. Makary, I want to thank you for joining us, and I want to thank you for your work that you took this on while the government had all the money to do it. They didn't want to do it. You did it, and it has added tremendously to the discussion and the debate, and we're grateful for it.
Good to be with you, Tony. Thank you.
All right, Dr. Marty Makary.